Hello, my name is Annabelle, and today I will be performing the tracheostomy care skills video for BSN 266. I am in my appropriate school uniform along with my badge. Make sure that I do not have any acrylic nails nor nail polish or excessive jewelry on my hands. And I want to make sure that I have two people performing the skills video. One person will be stabilizing the tracheostomy tube, and one will be performing the tracheostomy care. I want to make sure that I'm assisting my client into a Fowler's or semi-Fowler's position, as well as having a suction machine available and suctioning the tracheostomy tube as needed if they need it before performing the tracheostomy care itself. Okay, so to start off my video, I want to make sure that I have my clean gloves here. I have my tracheostomy clean and care tray. Okay, first thing I want to do is provide myself with some hand hygiene. And then I will be setting up my sterile field. Opening it up. Okay, and while I am setting up my sterile field, I want to make sure that I'm only touching the outside portion of the sterile field. And making sure that I'm only touching that portion and the 1-inch border. Okay, so while removing everything in the sterile field, I want to make sure I remove my gloves and carefully removing the actual sterile field. Okay, again, just making sure that I am being very careful and only touching the outside portion and the 1-inch border. Okay, once I've done that, I want to make sure that I remove the contents here and I just dump it right along on top. Okay. We'll make sure that I'm not hovering above the sterile field because that will compromise it. So in the basin, I want to make sure that, so there is the basin here, there is a bigger portion along with the two smaller portions on the bottom. The bigger portion of the basin will contain hydrogen peroxide and a saline mixture. And these two bottom portions of the basin will contain the saline. Okay, so at this point again, make sure that I am doing hand hygiene. I am using my clean gloves and making sure that I am not compromising the sterile field, staying away from it. Okay. Okay, and then at this point, if this person is still on oxygen or on any oxygen source, I will go ahead and remove that. Okay. Okay. I will go ahead and unlock the inner cannula and making sure that I am removing the inner cannula the same way of the curvature. Okay. And then at this point, I will go ahead and drop it into the hydrogen peroxide and saline mixture in a soaking solution. And then I will go ahead and remove the soiled gauze, which is right here. Again, making sure you are stabilizing the tracheostomy tube itself. But of course, you will have another person to do that for you. Okay. And disposing of the gauze. Okay. And then I will go ahead and remove my dirty glove. Okay. Provide myself with some hand hygiene. And then this is when I will go ahead and apply my sterile gloves. Okay, again, making sure that I'm only touching the outside portion of it and not compromising my sterile field over there, opening it up, and only touching the 1-inch border. Okay. And I will go ahead and start off by donning my gloves with the non-dominant hand, thumb out. Hands are sweaty, of course. stop. Okay. Again, thumb out, making sure. Okay. And then disposing of that. Okay, and then at this point, I will go ahead and grab my Q-tips here, and I will go ahead and put that in the saline solution. And I will go ahead and start cleaning the inner cannula. Okay, so I will put that up. We'll go ahead and clean it, clean the inside of it, or making sure that it's completely cleaned. Okay. Okay, dispose of the brush and go ahead and put the inner cannula in the saline solution. Okay, and then I will go ahead and clean around the tracheostomy tube itself. Okay, so with one, I will clean around here. Again, making sure that you are stabilizing the tube itself. Clean around here, dispose, grab the other one, clean around this area, dispose, grabbing the other one underneath, dispose, another one. Again, making sure that you are stabilizing the tracheostomy tube. And another one. Okay. And once that's done, I want to make sure that I'm grabbing my my gauze. My gauze. Okay, my gauze, and I want to make sure that I am cleaning, drying around the tracheostomy tube. Okay. Dispose. Okay. And then at this point, I will go ahead and grab my inner cannula, and I will go ahead and make sure that I am inserting it in the direction where it was originally, so curvature downwards. Again, making sure that I am lock it in place. And then at this point, I will go ahead and remove the tracheostomy ties. Okay, dispose of that. Okay, and then I'll go ahead and get my split gauze. And I will put that around the tracheostomy tube. Again, making sure that it's stabilized. And then I will grab my my ties. Okay, and then I will do a one tie method. Okay, so loop over here. Making sure I connect through this. And again, making sure that I am stabilizing the trach. Okay, and then while I am tying the knot, I am making sure that there is enough room for the patient, making sure that it's not too tight. I'll be assessing the skin as well at this point for any redness or skin breakdown. And I'll go ahead and grab a piece of gauze here, put it into a square, and that's where I will, right where I put the knot, that is where I will be putting the gauze to protect the skin. And also, while I am tying the knot, I am asking my second person to grab me a piece of tape. That way I can secure the gauze and the tie in place. Okay. And then I want to make sure that I am cleaning up my area, providing oxygen to the patient if they need it, provide suctioning to the patient if they need it, cleaning up my area. And then, of course, I will be making sure that I'm returning my patient into to the lowest height possible and removing and removing and discarding any of the sterile field. And then after I'm done with that, I will make sure that I am providing myself with hand hygiene. I am documenting in my charts to see what time the procedure was done, and then of course how the patient tolerated it, and making sure my patient has everything they need. Call bed in place, bed at the lowest position possible, and making sure all of their needs are met before I leave the room.